Good morning, everyone. I am Dr. Sunny from Assam Medical College, and my topic is spontaneous healing of bilateral Mooren ulcer. Mooren ulcer is a rare autoimmune disease characterized by progressive circumferential peripheral stromal ulceration with lateral central spread. Corneal perforation is much more common in Mooren ulcer. Mooren ulcer is more or less associated with Hep C, trauma, and parasitic infections. Associated with systemic autoimmune disease and corneal infection should always be ruled out. My patient, she is a 60-year-old female. She presented to our department with diminution of vision from the past 2 years and redness from the past 6 months, intolerance to light in both eyes from the past 2 months. On ocular examination of right eye, eyebrows, eyelids, eyeball were within normal limit. In conjunctiva, there was mild conjunctival congestions were seen. On cornea, conjunctiva as well as blood vessels encroaching over the cornea, leading on to the loss of transparency. There were multiple grades of opacity, such as glaucoma and macular grade opacities were seen, both in central as well as paracentral area. There was a limbal mass of 2 × 2 millimeters seen on 12 o'clock position with loss of architecture of limbal palisades. Pupil were irregular, which was sluggish reactive to light. Lens and fundus were not able to evaluate. Ocular examination of left eye, eyebrows, eyelids, eyeballs were within normal limit. On conjunctiva, there was mild congestions on the nasal side. On examination of cornea, there was a crescent-shaped juxtalimbal destruction of corneal stroma, which was extending circumferentially from 4 o'clock to 11 o'clock position was seen. There was an undermined leading edge at 11 o'clock position. There was overhanging edges extending from 4 to 11 o'clock position. Blood vessels encroaching over the thinned out cornea in the nasal side, extending from the limbus to the overhanging edge of the ulcer. Lens, it was NS grade 2. On investigation, USG B scan, there was bilateral cataractous changes and vitreous degenerations in right eye. USG whole abdomen, bilateral mildly raised renal cortical echo texture was seen. On keratometry of left eye, K1 was 49.75 diopter at 135 degree. And K2 40.5 diopter at 35 degree with BCVA of both eye hand movement close to the face. Rheumatoid factor, ANCA and ANA came out to be negative. My patient, as she refused for peritomy as well as amniotic membrane transplantation in her left eye. So she didn't give consent for the operation and was managed conservatively with plain steroid as well as adjuvants, along with painkillers. After 2 weeks of follow-up, in my patient, congestion and vascularization over the cornea were decreased, with best corrected visual acuity on the left eye improved to 1/60. Clinical implication in young patient, it needs to receive an immediate interest as visual morbidity stays enormous in this range. Recent studies have identified calgranulin C, a protein both involved in the immune response to parasitic infections, and which also happens to be found in corneal stroma as perhaps central to the pathogenesis of Mooren ulcer. More research and trials needs to be conducted to permanently derive a proper therapeutic regimen for curing this destructive disease. Since there might be an autoimmune mechanism involved, steroids and other immunosuppressive therapies have demonstrated an effective long-term response. Muthaiya Srinivasan et al. Concluded that Mooren ulcer is a rare and potentially blinding eye condition observed not infrequently in the cornea clinic at Arvind Eye Hospital. Men are affected more than women and may present with either unilateral or bilateral disease. Tarun Sood et al. Concluded that bilateral Mooren ulcer in young population needs to be given an immediate attention as visual morbidity remains significant in this variety. These are my references. Thank you.
So the patient,
please.
So the patient responded to the topical steroids.
Yes, ma'am.
Then I think the title, spontaneous resolution.
You mean no surgery?
Yeah.
No surgery was required because she refused surgery.
Yes,
So with topical steroids, she became all right.
Yes, ma'am.
Right. All right. So it can be a little bit modified, the topic, because it's not spontaneous, means absolutely no treatment given. And no surgical treatment was given. But
Yes, ma'am.
yeah, that's what.
Because 90% of Mooren ulcer patients, they respond to the topical steroids. So they might not need, all the patient might not need surgical intervention.
But ma'am, in my case, there was a corneal perforation, uveal tissue prolapse was there. For that also she refused. for example, banana graft. So we went to steroid, ma'am. There was a pseudo cornea formation, ma'am. That's why.
Systemic steroids were given?
No, ma'am. Systemic steroids were not given.
You could have given systemic steroids also.
Nothing systemically you gave.
Ma'am, rheumatoid factor, it came out to be positive, but it was mild positive. We took a medicine consultation. They said that rheumatoid factor is just 14.6, which can
Borderline.
be considered as 14.6, ma'am. And means, normal value lies below 12.
Yeah,
Medicine people, they told that 14.6 can be considered as negative,
yeah.
and you can.
Fair.